Let's expand on some thoughts that I've expressed and others have expressed with regard to the director of dentistry concept. And I'm looking at this from the senior doctor level. As a senior doctor, you've established a presence in your community. Likely, you've been a solo practitioner, have developed a presence in your community, a presence that becomes a magnetic attraction for your practice. You may have decided that you want to retire at a certain age. You've made the money that you need to retire. Congratulations. But you have a love for your practice. And you also have a love for your profession. You see things differently because you have the wisdom of 30 plus years in practice. The question is, do you have to give up your practice? Do you have to sell your practice to a junior practitioner and leave your practice entirely? My value to my practice is not my surgical ability anymore. Yes, I was a decent surgeon, and I could still do it if I had to. But a new patient walking into our office, seeing a doctor of my age, that automatically generates a level of trust that I didn't experience 20 or 30 years ago. Is it my reputation? Sure. In fact, the patient makes an appointment with our office based in part on my reputation. Is it my age? Definitely. Essentially, the senior doctor is often the magnet for the practice. In legal and business circles, you would be called the rainmaker of the practice. One thing that I bring to the table is treatment planning and communication skills. The assumption that I'm making is that if you have treatment planning and communication skills, you can be a very valuable asset to your practice. A junior doctor might do better if the senior doctor were doing the treatment planning and case presentation, and the junior doctor was doing the work. Think back to the way it was when you were that age. Remember how difficult it was for you to talk about treatment plans. So that's what we do in our practice. I examine the patient accepts treatment. Later, the senior and junior doctor go over the treatment plan. The junior doctor sometimes does an independent treatment plan, and then the senior and junior doctors go over together to iron out discrepancies. So it can work, and there is feedback. It isn't just the junior doctor being told what to do. And by the way, treatment plan means the entire treatment plan, restorative dentistry included. The periodontist cannot be a director of dentistry without the ability to do restorative treatment planning. Now that requires a few things. Number one, the treatment planning doctor and the treating doctor have to have similar philosophies. Number two, the treating doctor has to be able to call audibles during the surgical process. In other words, if what the treatment planning doctor predicts is not duplicated at the time of the surgical procedure, the surgical doctor has to be able to do what's necessary to do the case properly, of course. Once that happens, the junior doctor then reports to the senior doctor what happened. Or in an ideal situation, the junior doctor calls the senior doctor into the operatory to show the senior doctor what happened. This facilitates communication between the junior doctor and the senior doctor and will improve the senior doctor's ability to treatment plan based on the junior doctor's needs. Okay, number three. There need to be treatment planning sessions between the junior and senior doctor so that these details can be worked out in advance. For the most part, in our experiences, the differences between what I treatment plan and what my associate does has to do with the use of materials. As long as my treatment plan is close and we charge the appropriate fees, everything else can be ironed out in the operatory. There are minor changes made during surgery, just as there were minor changes in surgery when I treatment planned the case and I did the surgery. That always happens. And of course, we never charge the patient for those minor changes. It's key. Remember, we're charging the patient once. We charge the patient at the time of treatment planning and case acceptance. That's the end of charging fees. The senior doctor can remain in the profession of periodontics. As a matter of fact, the senior doctor has a great deal to offer both the junior doctor as well as the patient by remaining in the practice. The senior doctor can work part-time, doing examinations only. And more importantly, the senior doctor brings stability, experience, and judgment that both the patient and the junior doctor will benefit from. I haven't done surgery for 2 years. The practice has grown. Will I treatment plan forever? Of course not. The goal is to transfer those treatment planning and communication skills to my associate. And we've been doing that ever since he started, which was almost 4 years ago. We meet on Thursday mornings to go over treatment plans. He's also taking outside training in communication and sales skills. He's doing very well. From the junior doctor's perspective, that doctor may not want to relinquish treatment planning to the senior doctor. I understand that. Let me say this. If the senior doctor is good, has developed a reputation for putting together a good cogent treatment plan, and can communicate it well, then the junior doctor can benefit from that skill without diminishing the authority of the junior doctor. Now, there are some my age who still like to do surgery, and that's fine. And they're working a few hours a week doing both the examinations and surgical treatment. Continue to do that. It's okay. You do what you're comfortable doing. Your presence in that practice increases the stability of that practice as it increases the viability of that practice. You're also teaching the junior doctor how to run your practice. So continue to do that. The owner, the treatment planner, and the surgeon may be one and the same for most practices, but you can separate out each of those 3 positions and grow your practice. Look at each of those 3 skill sets as individual skill sets. You may find that your value to the practice will increase as a result. I'm Dr. Lee Sheldon.